So at ASCO 2024, we saw many interesting and potentially practice-changing abstracts in the colorectal space. One that I thought was very interesting was Checkmate 8HW, which was enrolling patients with MSI high metastatic colorectal cancer to Nivo and IPI versus chemotherapy. So what we saw there was that Nivo and IPI had better PFS and PFS2 than chemotherapy in the first line setting. However, there was more toxicity in terms of high grade events such as deaths in the Nivo IPI arm. So, something to be aware of. What I do think the takeaway is from Checkmate AHW and also Keynote 177, which looked at Pembro in a similar patient population, was that unless there's a contraindication to immunotherapy, all patients with MSI high metastatic colorectal cancer should get immunotherapy upfront as opposed to chemotherapy. Another really intriguing abstract we saw at ASCO in the colorectal space this year was the TransMet trial, which looked at for patients with very selected criteria, patients who had liver mets only, who had a host of other eligibility criteria, who are unresectable, were randomized to either liver transplant plus chemotherapy versus palliative chemotherapy alone. And what we saw there was that of the patients who were eligible for this strategy, the 5-year overall survival and a host of other endpoints actually favored the patients who underwent liver transplant. And interestingly, most of those patients who had liver transplant ultimately recurred in another organ, but that was able to be treated so that the overall survival, more patients were NED at the end of the trial. So I think that's intriguing data. It's not applicable for every center, certainly, because you have to have access to a good transplant center. And this is for definitely a fraction of our colorectal cancer patients, but certainly something novel and something to explore more.